Good morning. We are doing an early edition Project Next mental fitness show. I am so thankful that Dr. Jon Macy is with me today. We are talking all things public health, and I have a very good expert with me. He has his PhD in health behavior and is a public health professor at IU Bloomington. We did a show a couple weeks ago, maybe 3 weeks ago, with Dr. Tim Peck about Suicide Prevention Month and gun safety. So that was a really powerful episode. And I'm really thankful you did that with us. I hadn't met you when we did that episode. We talked about some deep stuff. So I thank you for doing that episode. And I thank you for suggesting this one. We are going to talk all about what is public health? Why does it matter? How is it being cut in Indiana and across the country? And what can we do to support public health again? Because public health supporting it directly links to your life and your success and your health and getting the things you need to live a long and healthy life. So we're going to break down the confusing data and just kind of clearly explain, why do we need public health in our life? Why do we need to fund it? Why is this not political? Everybody in the country should be focused on supporting public health. Jon, thank you so much for being with me today. How are you doing?
I'm doing great, Sarah. Thanks for doing the show again. It was, like you said, the last one we did on suicide prevention and gun violence prevention is another public health issue we talked about, but we thought it'd be fun to kind of talk about it more broadly. So yeah, thanks. This is fun.
Yeah, and Dr. Tim Peck was going to be on it, but he is on night shifts at the ER this week
Hmm.
and he was exhausted. And he texted me and he's like, I can do it, but I don't think I'll be at my best. I'm really sleep deprived. I'm not feeling well. And I'm like, I don't think I should force you to be on a mental fitness show, Dr. Tim Peck, when you need to
Right.
be sleeping. So he wanted to
Good
be a
point.
part of this. That's why we did it early to try to catch him at the end of his night shift. But, I told him, I was like, you're only human. I know that you do a lot more than most people, but you're still only human. So just, thanks to my co-founder and my friend, Dr. Tim Peck. I hope he is sleeping right now.
Yes.
Oh, all right. So let's get into it. First off, you have a PhD in health behavior. You're a public health professor. You have dedicated years and years of your time, your money, your brain to this topic. Why did you decide to go into this field and dedicate your life to this?
Yeah, I mean, this is pretty much all I've ever done my whole professional career in a lot of different contexts and settings. Um, I've been in academic public health at the university for a long time, but before then, I worked um, in local health departments, both in Indiana and Georgia, and worked in for nonprofits that did public health work in Indiana also, and then I also did have done some work overseas in some developing countries, all in public
Wow.
health, and it's yeah, it's a great career. I'm thrilled. I can't sometimes I can't believe they pay me to get to do public health work, and at the end of the day, it's about helping people live healthier lives, and that's really what it's all about for me. Um, yeah, is helping people live healthier lives. The people who work in public health tend to um, all think that same way, right? They're just trying to help people, and I always say that. And well, this I took this from Dr. Tom Frieden, who's a former director of the Centers for Disease Control, and was the director of the New York City Health Department. And he said public health has one underlying philosophy, and that's social justice. So it's just basically taking care of vulnerable people and giving people basic things that they need to live a healthy, happy life. And it has one underlying methodology, and that's using data to make decisions. So the whole field of public health is about using data science to um, to understand what are the best ways that we can help people live healthier lives, and in particular focusing on people in our communities that are more vulnerable and don't have access to health and other things. And so that's where we need to put our focus. So that's what it's all about. That's why I've done it and why I continue to love to do it.
I think that's really beautiful. I just want to say thank you for all the years you've already put into this. You've helped many, many people. You're helping with American society. You've even helped across the country to people that really need it. And it feels good. That's what you're saying. You love you get to do this job because it
Yeah.
feels good to help people. I was a teacher for 18 years. I taught mostly fifth grade, and I quit during the pandemic because of childcare issues, which was very common
Right.
for working moms during that time. And I all of a sudden had a hole in my heart where I felt like I was dying inside because I wasn't helping anymore. I thought just helping my family would be enough. And I was like, oh no. I poured my heart and soul into those kids, into helping those parents, into doing everything I could for them for 180 days to prepare them for life. And that was
Yep.
gone. And so then I started getting involved in my community. And that's a lot harder, but at the same time it's also very rewarding because it's bigger than a class size of 20 kids. So I get that
Right.
feeling of helping. It's sort of like a basic human need. I feel like we all have a desire to help others. We can stuff it down and ignore it, or we could need help ourselves, so we can't do it because we're in trouble. But if you're like living a healthy life, I feel like that's a big part of it, just helping others.
Yeah. And you end up learning a lot about yourself in the meantime, which is which
And I
is
think when you see
fantastic.
people struggling that are much less fortunate than you and I, it gives us a deeper empathy for
Hmm.
their lives. I see a lot of political judgment on people every day in the news and social media. And I'm like, can we just break it down and realize this is a human being and that they're really stressed out? So maybe they don't always make the best decisions, or they don't have enough money or resources or time to make better choices. Could we be a little bit more empathetic? And I feel like if more of us helped those that needed it the most, maybe our culture wouldn't be so toxic in that way.
That's
Does
right.
that make
Yeah.
sense?
People are not sick or poor because they want to be. They are had, for whatever reason, unfortunate circumstances. Um, Things didn't go their way. Um, they have bad family
And you
situations, bad
and you
community.
have
Who
data
knows
on
what it
that.
is?
Yeah, you
Huh?
have data on why people's lives aren't always as good as they could be, and
Yeah.
ways to make it better. So it's got to be frustrating for you to be like, I'm not being judgmental. I'm looking at this fact based. We could help this family or this
That's
person if
right.
we did X, Y, and Z with taxpayer dollars, right?
That's right. That's right.
Right. So what
And
sort of things do we do with public health? Where is this money going? We spend money on it nationally and statewide. Also, you can get grants and nonprofits and things like that to help out. But what areas does public health help with, and how does it directly correspond to helping our lives?
yeah, I mean, I think a lot of people don't have a clear understanding of what public health is. Like the
Right,
term itself is not that useful, maybe, or descriptive of
right.
what it is. But but if you think about like in your own community where people live and work and play and worship and the whole thing, public health really operates behind the scenes and is kind of invisible. And if things are going well, you don't really notice it. So just take as an example, um, when you go out to eat, you sort of take for granted that the food that you eat is going to be safe and protected, that the staff working there has been trained and in hygienic techniques and things like that. That's all public health. The local public health department where you live has staff that goes out and inspects restaurants where
Well, you
food
get
is
the code,
served.
like the A, like there's a piece of
Yeah.
paper hanging up on the restaurant. So people are coming. Our
Yep.
health department is coming to each restaurant and checking it and leaving a report on how healthy is this restaurant.
Yeah.
I want to pair that with the exact opposite. So Brian Zimmerman is my friend. He's a special forces veteran, and we've done quite a few shows together in the past. And he has been to over 20 countries across the world, a lot of them underdeveloped countries. And part of establishing connection with them is to go to the leaders of a certain town or village and eat dinner with them. And they would do this to show that they care about them. Many times, the special forces um, men would get sick from eating that
Hmm.
food. So, and like one time he got really sick by having a drop of water from a tent he was packing up go into his mouth. And so, like,
Wow.
we stand how lucky we are in this
Yeah.
country for this service right here, that our food is mostly healthy. When it's not, there's like reports issued, there's news stories, there's statements pumped out, people return the food or we know about it. Doctors are
Yeah.
notified, so we know how to treat people when they get sick, right? When like there's a bad, I don't know what you would call it, but when like spinach is bad, what is that, salmonella or something? Um,
Yeah.
yeah, yeah.
Yeah.
So we don't
Like
realize how lucky we are because we're not all Brian Zimmerman. We're not all special forces getting sick eating people's food from other countries, you know?
there's a yes, there's a whole system set up to protect us from from as that example from food getting contaminated. Um, and if that were to happen, and it does from time to time, where like lettuce or spinach or ground beef or something gets a bacteria in it, and people unfortunately become ill from eating it. But there's a whole system in place set up to stop that as fast as possible, to get the food off the shelves, and then do an investigation to figure out where it came from and trace it back. It involves interviewing people who ate it, where did they get it, um, and tracing it back to all the way back to the farm, for example, where it came from, and then figuring out what went wrong so that that food got contaminated. That's all public health, and all requires investment and funding, and and that money has to come from someplace. And if we want those services, then we need to invest in them.
So, do
And
you know? I didn't ask you beforehand, so I don't know this, but is food safety public health being cut right now,
sure,
or has it been cut?
um,
Okay.
I mean, all it's kind of hard to tell. I mean, there's a lot of back and forth on what's being cut, and you know, efforts to shrink the government workforce, and then people will get laid off, but then they get rehired. And so I think
It's going to
it's a
take a
little bit
few
hard to tell.
years to know the specific data, is what you're saying. But yes, it is being cut. I remember seeing something, Adam Conover. He's a comedian, but he does a lot of fact-based stuff. He has a podcast called Factually. I've seen some stuff from him, some reporting from him and experts on the food safety thing, that yes, it is being cut. So if you look at the science, you look at the data, more people will get sick from our food because of this lack of funding. And we'll
Yes,
get the specifics in a few years once we have the data, but we know they're cutting. It is going to hurt. We don't know exactly how, but yes, right?
yes, and
Yeah.
then there, and I mean the other thing is that public health is always trying to solve problems, right, and address things that are causing preventable illness and death, right? That's what it's like. Public health thinks is a very much in a prevention
Right.
lens, and thinks there's too many people getting sick or dying from. Let's take the example of, which is an example of a public health success story of automobile safety of cars,
Yes.
right?
Hmm.
If you go back in history, not too long ago, there were a lot of people who got injured and died in car crashes, and kind of as a collective society, and with viewing that through a public health lens, we said that's not okay. And those injuries and deaths in cars are preventable. We can do things about them, about that. What does it take? It takes investments of resources to do research to figure out why people are dying, what are the causes of it, and then how can we fix it. And what did we do? We made roads safer. We made cars safer. We require people to wear seatbelts. Those are all public health initiatives that have resulted in dramatic declines in automobile deaths, automobile car crash deaths, that those rates have gone down dramatically. And that's a public health success story and a public health victory that we should celebrate. And we
I
need more of
probably
those.
wouldn't be here today talking to you if I wasn't wearing my seatbelt and in a very safe car. Right after the 2022 election in November, I was driving down a hilly road, and it
Hmm.
was foggy and a little wet. And I was going really slow and really carefully. And a woman lost control of her car and spun and hit me in my driver's seat, and thankfully I was the only one in the
Yeah.
car. And my emergency car took over and turned the brakes on because I was being hit, so I did not handle the car correctly. And then there was a railing on the side of the road that prevented me from falling off the cliff of this hill. It was Paley
Wow.
Pike. And then a bunch of people called 911. I remember I called 911 once I got my wits about me, and 20 people had already called. And then 911 came, and I barely had any injuries, and my car was completely destroyed, and it was destroyed where I sit in the front seat. And I had some PTSD from it, and it messed with me for a little while. But now I'm stronger from it, and I'm just so thankful. So to everybody, the public health, all the people that demanded seatbelts, all these safety things for our cars, literally saved my life. And think
Yeah.
about all the other people. Most people I know, if you've lived a few years, have been in some sort of automobile accident and are
Yeah.
fine or sustained slight injuries. So it's kind of mind-boggling when you think about it. The thing you just said
Yeah.
is a reason I'm probably alive today.
Oh, it's saved tons of lives.
Yeah, yeah.
Lots and
And
lots of lives.
so the preventing of things is hard to see, and I think
Yes.
that's why it's politicized so much. You can't immediately say this money, well, you kind of can. This is kind of frustrating. You kind of can with data and science say this money is going to impact and save this many people, but because you don't see it immediately, and we kind of have short attention spans, especially those in the government right now, and we always want to blame people and stuff. It seems like it's being politicized and cut when it's going to hurt all of us, regardless of how we vote or if we voted.
It's one of the big frustrating challenges of working in public health is that you often don't see immediate benefits.
Right,
It's
right.
right. It's something that the benefits are down the road. I mean, we've known forever and ever. We've had a saying: "An ounce of prevention is worth a pound of cure." Right? And if you can spend a little bit of money on prevention and save a ton of money down the road, um, from having to take care of a sick person, as an example. But the the payoff is so distant, and you don't see it, so it makes it really, really, really difficult.
You need
Um,
you need good people in power that understand this issue, that are talking to people like you and learning and then making policies that support public health instead of the division that we have in our country now, the fighting, the not negotiating, not not compromising. That is directly hurting all of us.
yeah,
So, yeah,
yes.
yeah,
I mean,
yeah.
a really another really good example is of a public health victory and success story is with reducing cigarette smoking rates, right? And we had, I mean, and still, cigarette smoking is still the leading preventable cause of death in the United States, believe it or not.
Wow. I didn't know that.
Um, but we have reduced the cigarette smoking rates in this country dramatically. But that took a ton of work, investing in public health, investing in research to figure out the solutions, knowing what the right approaches were, and then putting them into action. And you have to give, our own state of Indiana credit here that about 20 years ago, Indiana was leading the country as far as investing in preventive measures around reducing smoking in Indiana, and we've done good. The problem since that time though that funding and those investments have kind of, they've gotten eroded and greatly reduced for all the reasons you've mentioned with politics and, people wanting their piece of the pie and, not enough to go around. So we have to fight for it, all those kinds of things. But I remain, at the end of the day, I do remain optimistic that we know how to do this. We just have to get together and be willing to make investments up front and on the prevention side that we know this, they will pay off down the road.
I have a really good question I want to pull up. It said, is smoking cannabis just as harmful as nicotine or tobacco smoking? I know cannabis increases someone's anxiety. At least I heard. Just side note, in Indiana, it is illegal, but there are, I don't know, is it around half the states around the country that it is legal. So yeah. So let's talk about that. Do you have any public research knowledge about marijuana?
Yeah, well, the thing about smoking marijuana or cannabis, it compared to smoking tobacco, right, is you don't tend to do it as often, right? So, like if you're like a
So it's not
nicotine
as
addicted,
habit forming with nicotine like nicotine is.
well, there's lots of reasons, but I mean it is, but not as much. Nicotine is way more addictive,
Okay.
um, and it's legal, like it everywhere, right?
Right. You can
Nicotine,
buy it at
and
stores really
so
easily.
you can buy it everywhere. You can do it, and if you're nicotine addicted, you tend to ingest a lot, right? Like
Right.
if you're a half a pack or a pack a day
Right.
smoker, as an example, you're ingesting a lot of harmful things down into your lungs. People who use marijuana, cannabis, don't tend to use it in that large of quantities, right? So it's you're it's less socially acceptable, although smoking is becoming less social, but still, smoking marijuana is
Right.
still less socially acceptable. It's illegal in a lot of places, um, and so you just do it less. And so, it's sort of an apples and oranges comparison.
Yeah, I was gonna say it's sort of
Um,
hard to compare because this drug is used medicinally quite a bit to relieve pain, like in like a cancer patient or some type of illness that you have that
mhm.
causes a lot of pain. It can be used to that. So it's a little bit different. But I have heard that smoking it is still harmful to your lungs, but
Yeah,
you're just
I mean,
saying it's still
whenever
harmful,
you
but it's not the same as cigarettes.
yes, whenever you light something on fire and breathe it down into your lungs, it's not good for you, right? And so, um, like with tobacco, when you light tobacco on fire and breathe it down into your lungs, like you do with a cigarette, it's going to be bad for you. Same thing with marijuana leaves. Um, and of course, there's lots of different ways to take marijuana with um, gummies and all
Yes.
these kinds of things
Right,
that
right,
are out
right.
there.
I think
Um,
it's a complicated
and
issue. We could almost do a whole episode on it.
yes,
I'm just like my thoughts are it's not good for you. It shouldn't be illegal in Indiana. And also we should invest public health resources to educate the public on what taking different forms of marijuana does to your body because I do feel like it's such a political issue that it's pumped out that it should be legal and therefore it's great. Well, I think it should be legal. I don't think we should be filling up our prisons with people smoking marijuana, but I also think that we should know what happens when you take it. And I also
absolutely.
concerned when it becomes legal, the dosage, the amount of like the chemicals that affect you are stronger. In one hand, I think it should be government regulated to make it safe for people
Yes,
instead of buying it illegally from somebody in the
yes,
parking lot or whatever. But at the same hand, I think we should be very knowledgeable about what this drug does to us and regulate it so that it harms as few people as possible. Like that's my
yes.
thoughts. Yeah.
Agreed. And again, it goes back to we need to invest in research to be able to know these things for real, right? And
Right.
so it took many years to figure out, why is smoking cigarettes harmful and why, and how do we prevent it and how do we help people quit? And now in that world, things have sort of shifted over to vaping, right? And
Right.
so we're still trying to figure out how
Vaping
bad is
was
vaping.
posed as a better
Yeah.
alternative to smoking, and it might be better than smoking, but it also creates its own problems.
Yes.
Also, you're inhaling these chemicals, and a lot of the vaping has like all this smelling things, like they smell and taste a
Mhm.
certain way. That's
Yep.
chemicals you're putting into your body, and we don't know what that's going to do because it's so new, right?
Right.
So
Right.
I am
Yes.
concerned
And
about the vaping. I know a lot of people
yep.
that vape. Um,
Yes.
yeah,
And do the flavors are the flavor do the flavors make vaping more attractive to kids? Probably.
yes, because it's like
And
candy type flavors
yes.
and stuff. Yeah.
And so, yes, that's just all of this is are great examples of complicated problems that we need to study and understand. And in order to do that, um, we need resources. So we need to invest as a society in understanding what's really going on with these kinds of things, and how do we need to worry about them? Do we not? Which
So
one's
I would,
worse?
if I were in charge, if I were in charge of public funding and had some sort of power, I would do my best to educate everybody else that had some power to pass legislation to support funding for, let's figure out what's going on with vaping, and maybe let's pass some laws so it's not pushed out to kids, and let's let everybody know what happens when you're vaping,
Yes,
like we were doing with cigarettes. Also the marijuana, the gummies, the all the stuff that's being pumped out now in states where it's legal and it's very easy to get, in other states where it's not legal. We need that information. So public health could be providing that if it were properly funded.
yes. And so
Yes.
when you hear about the National Institutes of Health, NIH, right? And that's well, that pops up in the news from time to time when Congress is deciding on what they're going to fund, making decisions about where money goes. A lot of the research that has been done in the past to figure these things out was done through the NIH, the National Institutes of Health. It's a large research, public health research, and medical research government agency in Washington D.C. that they do their own research, and then they fund a lot of you know research around the country at universities and other entities to figure these things out. And it's what has made our country, like the leading biomedical public health research engine in the world, and why we've had a lot of public health success stories. And
I know, I've
cutting
got
that
like,
is
yeah,
puts us at
I've
risk.
gotten texts in the middle of the night from Dr. Tim Peck when news comes out of public health funding being cut, and how upset he is because he knows it's going to hurt people. He's in the ER, he's seeing people, everybody, it's the ER, the emergency room is a great equalizer. Everybody needs it sometimes. And
Right.
he knows it's going to hurt people, and he's just so frustrated. He's like, we need to do a show on this and let everybody know about this and this. And so I kind of feel where you're coming from, seeing my friend Tim just so angry because you guys have the knowledge. You know what we need to do to protect and care for our community, and you're seeing being attacked right now. And it
Yeah.
shouldn't be political. It's not really.
It's not.
Another thing we could kind of combat. I just want to talk about the other issue. So I believe the right kind of says things like we should let private companies be in charge of this, and we should cut governments from doing it, cut the fat, cut the spending, let private companies do that. But there's harm in that because private companies want to make money. They want to pay their shareholders. So when we stop services where we're just trying to help people, that's the benefit. That's what the government's trying to do, is help people. And yes, there's mistakes, yes, there's problems, but when we turn that over to private companies trying to make a profit, we don't always get honest information from them that can end up harming us. Do you agree
Right.
with that? Do you have thoughts on that?
I mean, yeah. Well, your point about the objective of a private corporation is to increase shareholder value, right? I mean, it's about making money. And so if there's things that we need to study and do research on that um, don't have a direct benefit as far as making a company money, then somebody's got to step in and do that work, right? And so that's the role of government to do that. there are for sure examples of private corporations doing really high quality, great research, like
Right.
drug companies, for example. If you've taken Eli Lilly, a company right here in Indiana, in Indianapolis, they do really high quality, rigorous, excellent research because they want to get the best drugs out there on the market to make people better, to cure disease and things like that, and that's fine. They do that, but the government and universities, there needs to be research that doesn't have any that needs to
Incentive.
fill in the gaps for
Right.
where there's no
Yeah.
incentive to be making money off of a
Right,
product or
right, right,
things like
right.
that.
Right. And
So
we can look
yes,
at examples of this, like the cigarette industry. They pumped a
yes,
lot of propaganda into the world and the country about how great smoking was. They used to like have ads that it was good for your health. Until
yeah,
and then the research started coming out and the cigarette companies were not like, "Oh, let's quickly change and stop everything because this is hurting people." They're like, "No, this product is addictive. It's making us a lot of money. We're going to keep doing this." So the government had to come in and slap on regulations. So we need the government to regulate. If we keep cutting government programs, we're going to get less regulations. Therefore, sometimes companies that want to make money are going to get away with things that are going to hurt people. So
that's
we've
right,
got to fund the government programs to have checks and balances. And that's
correct,
a big part of public health, in my opinion. And it's a really
yeah,
important part of the government.
yes, absolutely.
So let's see, we talked about smoking. I'm sure there's been some good things about drinking, public health helping with like drinking and driving. I grew up seeing a lot of campaigns. I knew not to drink and drive. That was pretty ruled into me. Was that like a public health campaign while I was growing up?
Yeah, yeah. I mean, um, yeah. Don't drink and drive. Mothers Against Drunk Driving. All of and that's another area where I would say we've been successful in really sort of changing the norms around that that designated driver, all of these kinds of things that we sort of take for granted now were all public health initiatives that somebody had to come up with these ideas and start to change people's attitudes about these issues.
And do
And
we
yeah, I
have
mean,
like
the list
data
goes
that
on.
shows it worked? Did it work? Did it lessen drunk driving? Did it lessen deaths?
Yeah, I mean, this is related to what we were talking about earlier with just motor vehicle crashes and injuries and deaths in general. That all of these things have been successful in reducing the amount of people who get hurt or killed in a car crash, whether it's alcohol related or not. Um, Absolutely.
Yeah.
That's
I just want to talk about if we were fully funding public health right now. I mentioned one thing I'd like to be working on. Let's get information about marijuana and all the different ways and vaping. So that's something I wish we would invest for public health. There's a new thing that's not exactly a drug, but I wish public health had fully funding for to work on this. And that's what is happening to our mental health by being online so much and by like algorithms and social media profiting off of like our fears and like trying to
hmm
keep our attention. There was a study done about Instagram, for example, and particularly teenage girls, and how the Instagram algorithm was showing them beauty products, products to make them skinnier, a lot of models to just to make girls feel terrible about their bodies and their appearance and that they needed to buy certain products or go on some weight loss journey. And
yeah,
these are young girls. So I would like money invested on that and then actual regulation of like, hey, Instagram, hey, Meta, here's some regulations so that you're not harming our children.
yeah, totally. That's the thing, right? There's always going to be new challenges, let's say, that arise, right? Just as we go through our lives and evolve as humans in a society. We mentioned, like, from my perspective, in a really traditional public health sort of lens, we're like, oh, great, we've sort of figured out this smoking thing. right? Like it's really rare for teenagers to smoke cigarettes now,
Right,
like,
right. I
right?
agree. Yeah.
Like it's really rare. But then all of a sudden, vaping, and we're like, oh no, now we've got a new problem to figure out, right?
Right.
Um, and so that's in the example you just gave with social media is another one. Like when I was a kid or a teenager, even there was no social media, and now there is, and now it's everywhere, and it's infiltrated every aspect of our lives, and how is that affecting our kids? We don't really know, and
Right.
so we
There's
need
been
to
some
kind of
small studies, but we need more. And then we need
we
to use the public health official reports as evidence for why we need to regulate better these systems, these things. And if we don't
yeah
have the public health facts, it's hard to change the system that's harming people.
yeah
But yeah,
we need to find out if things are harming people, and
right,
from like and how much and in what ways, and all of these kinds of questions are complicated and just take time and money to be able to do
right,
it and do it right, so that we have the best information that we can have to make ultimately to make policy decisions,
right,
like your suggestion. Like, do we need to regulate these things, and how much, and what would be effective? You can't just make it up. You need
right.
like science and data to make informed decisions, and which is
Yeah.
what, going back to the what I said at the very beginning about public health, it's all about using data to make decisions. We're not just making
And
decisions out of our gut or because we think
right,
that's
or it
the best
looks like this,
approach.
let's make a knee-jerk reaction to do this, and then that's not the
Right,
right one. That seems to sort of be what's happening now instead of
right,
using research and data. It's
right.
just knee-jerk, "Oh, it's in the public eye, let's solve it this way," and there's no research to back up if that's the right way or not, and then public
Yeah,
health people are like, "Wait a minute, we don't know." That, we've talked about it before about, like, correlation, like, just because something happens at the same time as something else doesn't mean they're related, and
right.
sometimes our culture just merges those things together and they're not related, and we need science and research and data. Yeah, I want to talk a little bit about, I'm a Democrat, so I see a lot of Democrat fed type news, but I'm talking to my Republican friends to see what type of news they're seeing, and I got sent something from a senator. I think his name is Senator Josh Hawley, and
Hmm.
he was saying he had concerns about AI, and he was using real examples of a teenage boy that his AI helped him with assisted suicide. And I'm like, "Oh, that's something we should be researching right now." Because AI is everywhere. I used it
Yeah,
today to get information about this episode. Um, it's so brand new.
yes,
We need to be researching that. And if you are a parent, you need to be very aware of what your kids are doing on their phones or their computers. So, like, my kid isn't on social media, thankfully. If he was, I would get on his social media platforms on his phone and I would look through and see what the algorithm is feeding him. My friend Corinne says her two sons, they're the same age as my kid, they're on social media and she flicks through it and she finds very white supremacist type racist stuff being pumped to them. And so they all exit and try to stop it, but she says it keeps coming up because they know that they're like white teenagers,
hmm,
and that is alarming to me. So, like,
yeah.
AI, the algorithms, this is stuff that we have evidence it's harming our country and it's harming our children. I want public health researching this. Do you know if it is? Are we spending any money investing in this right now?
Yeah, I mean, yes.
Okay, that's good.
These things are new, sort of emerging issues, and so the AI one is a great example of like social media has been around a little while, but still not that long in the grand scheme of things, and AI is now coming on the scene. So yes, people are concerned and doing research to the extent that they can, but again, I think like people have to understand that this just doesn't happen um, without kind of everyday people demanding it of their elected officials,
Right.
and and policymakers, people who make the decisions of how we're going to allocate resources, need to be convinced that these are the right ways. These are good uses of our public resources, um, and that's a challenge, right? And
So
I
yeah, we
so
could talk about that now. You offered a great solution here. The public becoming aware, which we are. People are hearing about the scary things with AI. I would think most people are aware. Most people are slightly worried about their children on social media. These are things that it's not partisan. Most people love and care about their children and want what's best for them. So, what should we do? We're concerned. We want public health to spend money on these things. It is some, maybe we could support it more. What should we do? We don't have positions in power, but we vote. What should we do?
Yeah, the first thing is always, sort of become educated, right, about how do these things work, and and think about what's important to you. Like, we talked about sort of the basic, some of the basic functions of public health, of keeping, making sure it's safe when you go out to eat at a restaurant,
Right.
or keeping our food supply safe, or um, keeping the swimming pools clean where your kids go swimming, right? These things that are traditional public health functions, um, or or you're concerned about some of these new emerging things with effective social media on kids, um, AI. We had a whole episode on gun violence. Um, all of these things are public health issues, and so understanding, where do the resources come from that fund the agencies that take care of us, and making sure that they're adequately resourced, what in your local community and in our state. um, Sadly, Indiana is one of the has one of the lowest kind of per capita funding rates for public health in the country. It's not
Really? I
something
didn't know
Yeah,
that.
it's
Ugh.
not something we've ever been really great about. We don't fund public health very well in Indiana. And
Huh.
so in all of our counties, we have 92 counties in Indiana, 92 health departments. They are all under resourced, understaffed. They don't have what they need to do their jobs, and that's just not
I
okay.
was doing a little bit of research before this episode, and it looks like the next budgets, the budgets that are happening now, that they're the new thing, there's tremendous amount of defunding. And so I imagine all of the health departments in these 92 counties are trying to cut the things that will hurt the least amount of people. However, these cuts will hurt people in every county in Indiana.
Yeah,
Is that,
there's
yeah?
there's nothing to cut, right? Like, there's
Because we
not
should be
excess.
funding it more. We should be funding
Yes.
public health more, but instead we're cutting it significantly when it's already defunded. So we
Yeah.
will be seeing things stop. Like, I'm wondering, last year I went to the library 2 minutes from my house, like 1 minute from my house. I could walk there. And I got me and my family flu shots for free. We just filled
Right.
out some paperwork. And I'm like, is that still funded this year? I don't know. Is that going to happen? I don't know. I need to look into it. Is it going to happen next year? I need to look into it, because boy, was that convenient. Because
Right.
normally I have to schedule a doctor appointment and go all the way down to New Albany and take my kids out of school. And this time I just got them off the bus and took them over. So yeah, it's going to be interesting to see what's cut and what's not. And I imagine also what's going to be cut is knowing about the services. Like, that
Yeah.
costs money.
All right. I mean, we ought to just be able to rely on, you ought to be able to rely on the fact that you can go to the library or wherever and take care of your flu shots and not really have to think about it,
Right.
right? But as things get cut and reduced, then you all of a sudden, this is another thing that you have to worry about. Where can I get it? Can I even get it? And it's just
And it
yeah,
just puts
it's a problem.
stress on individual households to do a
Yeah,
thing, or maybe it slips and not as many people get their flu shot and more people get the flu. And then older
of course that's what's
people,
going to happen. Yeah,
babies, more of them get infected with the flu, more of them will pass away. I mean, it will result in more deaths, unfortunately. So it just takes a little time to see the data that that's going to happen. But you're like, yes, of course this is going to happen. If we're cutting this, it's going to
yeah,
result in that.
right,
Yeah. Yeah. And
right.
just the the stress on the families. We're already
Right.
stressed enough. A lot of us people are working, every parent is working at least one job. They're very busy. So it's just another stressful thing they got to pack in their day that causes anxiety when we could be relying on our public health department to provide a service for us that helps us tremendously. And we kind of take for granted, I think.
Yeah, definitely. That's that's absolutely true. So, um, yep. So we were talking about what can people
What should we
do?
do? Right. What should we
What can
do?
so yeah. So I mean,
Get
talk to your
informed.
elected to get
Okay.
informed.
Talk to your
Figure
local.
out think about what's important to you. What are your priorities, and then um, talk to elected officials. Whether it's at the local level, know who your elected officials are. That's part of
Yes.
getting
I'm going to
informed.
say most people don't know. I didn't know until a few years ago when I started
Right.
getting more involved. Right.
So know
And just look it
who.
up, Google it.
Yep. Know who represents you up in Indianapolis in the state house, and they want to hear from you. They want to hear from their constituents about the issues that are important to them. And then same thing on the national level, right? So we have
Now,
two
what if they
senators.
do? We have problems in Indiana. I don't know if you know this, but when we contact our elected officials, not all of them get back to us. So, what if you contact your state house rep, your state senator, you email and you call and you don't hear anything back? I would say, let it be known. Hey, I contacted our state senator and our state house representative about public health funding
Yeah.
and why are they supporting or not, or, why aren't they supporting public health? And they never got back to me because I'm just going to say that step that you said, they do not always contact you. There's a lot of quiet ignoring going on in the state of Indiana that I see, that I'm frustrated about.
Yep. And if if that's the case, then guess what? There's an election coming up for that person.
Yeah,
And if they're
every
not,
2 years for state house, every 4 years for state senate.
yep. And if they're not doing their job of interacting with their constituents, then let's get a new person in that spot.
And then research the other side, whoever's running against them, and ask them. I bet they'll be more likely to contact you because they're trying to get your vote, whereas the other person's just hoping to keep getting voted in. I bet you'll have a
Yeah.
higher chance of the other person responding, and then you'll because like when I ran for state house in 24, some of the issues I didn't know, and constituents, voters came up to me and said, "Well, what about this issue?" And I was like, "Oh, I need to research that." I researched it, and then I got back to him, and I'm like, "Oh, well, I would do this to try to support that thing."
Yeah.
So it's very important for you to contact your elected officials or those running so that they know the things that are important to you, so that when they get elected, they follow through and work on those.
Yep.
Yeah. Yeah. So okay, so that's good. This is a really important one that I think we could do. Tell people how important public health is. Like you said at the beginning, most people don't know, kind of sounds boring. They don't realize how much it helps our everyday lives.
Yeah.
Not everybody's going to watch this Project Next show as much as I'd like them to. So go out and tell your people, tell the people that you love that we need to fund public health. And Indiana is one of the lowest states in the country for funding it. And then make sure that they're going to vote, or if they want to do something more, give them the next steps, help them.
Yes.
Like I do this with my mother-in-law, who's very sweet and will make calls. I'll be like, "Oh, we need to call about this issue," and she's like, "Got it," and she'll spend the next day calling and emailing those people.
That's great. Yeah.
Yeah.
I think that's right. Is there's been a lot of messaging campaigns over the years for like what is public health, and they haven't been all that effective. And so just having conversations with people about what it is, why it matters, everything from the day to day, just protecting our health kind of stuff that we don't even think about, to the figuring out these new emerging issues that are breathing down our necks, like the great examples you've given of social media and AI. Like here they are, and we need to understand, is it good? Is it bad? What way is it bad? And what do we need to do about it? And we're not going to figure that out without having good research and good data. And that just takes a little bit of investment of money to do that.
I was talking to my friend Christopher Machen. He's 21. He's a Republican, and he's Tim Peck's nephew on our show yesterday, on our mental fitness show. And I mentioned I was going to do this show with you. And he's like, "Oh, I fully support public health." So here's a Republican saying he supports that. My guess is most Republicans support funding public health. Those people are not represented in our government right now. This is not a partisan issue. That's what I want people to realize. Just because your elected official might be a Republican or a Democrat, don't just assume Democrats are funding it, because not all of them are. You got to go and take the next step and treat them as a human being without the label and see what they actually think about this matter.
Yeah.
So take the labels off. I would say that would be a very important step to pushing public health. Take the labels off and ask each individual person in power, do you care about our community, or do you want us to suffer? And get them on the record. Are you just going to do blindly what your party says to do, or are you going to step up and do the right thing for us? And those are the type of people I want to help get elected in this next election.
Yeah.
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 Yeah. This has been a really wonderful conversation. I'd love for you to text me when you have an idea about another show. Like, I think a marijuana show might be really informative.
Hmm.
I've never tried any of it, so I'm very uninformed about it. So the data, the stats, what's happening when it's legalized in different states, anything just to let people know, because I bet there's just a lot of misinformation out there about it since it's so polarized an issue. I kind of would
Yeah, that
like
would
to
be a good
take
one.
away the politics and just examine it, because I feel like my Democrat side just wants to push how great it is and let's legalize it. And I'm like, it's a black and white issue, or it's not a black and white issue. This is gray. Yeah, I agree with the let's not arrest people for it, but let's talk about the actual health benefits and the negative things from it, so that we can make a better choice for our bodies. We only have this one body. We're only alive for so many days on this earth. I kind of feel like we should do the best we can to be healthy and happy. So yeah, you
Yep.
just let me know. Yeah, and thank
Yeah,
you.
that's an,
We are talking about things to do to help with this issue. You're doing them, my friend. You're doing them. You asked to come on this show. You asked to get a time. You said you wanted to talk about this issue. And I just am, I'm so thankful that you did that. And I hope that you keep coming on and doing these shows with us so that we can get these really important issues with facts and science out there, and how we can work together to stop the bad and to encourage the good.
well, yeah. Well, thanks for doing this. This whole series
Yeah.
is important and fun, and it's always fun having chats with you on this show. So happy to do more,
Yeah,
and
same. Yeah.
keep up the
It
good
helps
work.
my mental health. It helps my mental. I do a mental fitness show, and every time I do one, I feel like I'm a better, healthier person.
Great, great.
Please share the show, everybody. We're on Substack Live now, so you can follow us on Substack, Project Next Indiana, and then you can get emails of the show. We're on podcasts, Apple and Spotify. We're on Facebook, Instagram, YouTube, and then short clips are also pumped out on TikTok. So those are where you can follow us. Please invite a friend. If this episode would help somebody that you care about, please send it to them. I usually copy the YouTube link and I email it to them, or not email, I text it to them and say, hey, this episode might help you with this thing.
Cool.
So if you wouldn't mind doing that, everybody, that helps us. We are an independent media company. We want to stop the fear, hate, and division messing up the country. And that is sort of what the algorithms like. They like fear, hate, and division. It keeps your eyes engaged to their algorithms. So our content is not always pumped out as much as the stuff that's like, this side was terrible, look at what you did. And the other side's like, this side was terrible. That stuff's what's selling. And we need your help. It's kind of like a grassroots people movement to push this platform through so we can help as many people as possible. Thank you, Dr.
Thank
Jon
you.
Macy. Good luck with your classes, and just keep texting me so we can do another show later.
Okay, we'll do.
All right.
All right. Thank
Bye,
you.
everybody. Thank you so
Bye.
much for being on. Have a great day.